Hello everyone, this is a video on Bill Gates and his vaccinations and some of the bodies who are involved. UN, the World Health Organization, GAVI, the Global Vaccine Alliance, ID2020, and the US CDC. They're all involved. Now, I spent some time on the UN website just doing a little quick search, and if you go on there, type in Bill Gates and vaccines, you will get 53,271 results. That's absurd. His vax agenda is promoted throughout the UN, and there's all kinds of news on it, reports, speeches, the whole 9 yards. We're also going to get a little bit into the UN Population Replacement Division. This is a real thing. It's not just some alt-right conspiracy theory. It's a conspiracy reality. And Bill Gates doesn't believe his children should be vaccinated, but yet he pushes vaccine throughout the world. This should tell you what he really believes. However, what is truly mind-boggling is the scale which his organization, the Bill and Melinda Gates Foundation, has been active and financing vaccines elsewhere. The included sections are just a small sample of what he's been up to. And it's also chilling the U.S. population division that he's been involved with. Now, April 2015 population control meeting. I'll leave the link in so you can check it for yourself. One of the panelists, David Kress for the Bill and Melinda Gates Foundation. Now, during the next 15 years, a period covered by the post-2015 United Nations Development Agenda, or Agenda 2030, demographic trends will have varied and profound implications on our ability to achieve sustainable development, suggesting the potential for large returns on investment in dedicated research on population and development aimed at informing innovative and evidence-based policies. In order to review gaps and future priorities in demographic research to support the implementation of the post-2015 development agenda, the Population Division convened an expert group meeting on the post-2015 era implications for the global research agenda on population and development at the United Nations in New York on April 10, 2015. The purpose of the meeting was to discuss research priorities on population development that merit global attention over the next 15 years. This is a policy-relevant research agenda on population and development. And among the topics, population and health, one session in health and one in reproductive health, sustainable urbanization, and international migration and development. Again, the links are in the article, so feel free to check it out. And among the contributors at that meeting, Dan, Director Integrated Delivery for the Bill and Melinda Gates Foundation. Also, Amy Sue, Professor at the Bill and Melinda Gates Institute for Population and Reproductive Health, Johns Hopkins, Bloomberg School of Public Health, Baltimore, Maryland. And that was 2015. In 2018, another population expert meeting. Links are included as well. While much has been achieved in curtailing the HIV/AIDS epidemic the last 25 years, there is a need to analyze inequality in accessing health services for different population groups in order to identify appropriate responses. Universal health coverage, one of the targets of the 2030 agenda, would be instrumental in this project. And one of the speakers there, Mr. Wynne Brown from the Bill and Melinda Gates Foundation. And getting healthcare for everyone and eliminating millions of diseases for millions of migrants on the move. If only someone was willing to finance this research. And I'm just going to quickly go through a few of the things that Gates has been financing. Oral polio vaccines. The World Health Organization spearheads the GPEI whose ultimate success would mark an early milestone in the decade of vaccines, which in turn represent a global vision to provide all children with the vaccine they need. A major GPEI donor is the Bill and Melinda Gates Foundation, whose co-chair, Bill Gates, also spoke on the significance eradicating polio would have for combating other diseases. Ebola testing in Guinea. And all of these are within the last decade. This has been going on. Experimental Ebola interventions. WHO, the UN's Children Fund, UNICEF, the U.S. Centers for Disease Control, the CDC, the Bill and Melinda Gates Foundation, and the Vaccine Alliance, GAVI, are collaborating with affected countries to develop plans and strategies for large-scale introduction, should this be needed. WHO said the vaccines manufacturers have assured that enough vaccine will be available in the coming months and that financial resources are in place to procure and make vaccines available in the affected countries. The vaccines manufacturers have assured them that enough of the vaccine will be available. Okay, great. Have they assured them that these vaccines are safe? Pentavalent. It's a 5-in-1 vaccine. This will protect against diphtheria, tetanus, pertussis, hepatitis B, and Haemophilus influenza type B, all of which are potentially deadly infections. The doses will be distributed to transitioning countries and those supported by GAVI. Since 2001, a strong collaboration between the GAVI Alliance partners, which includes UNICEF, the Bill and Melinda Gates Foundation, and the World Health Organization, has generated great success. And it'll now be on sale for 84 cents a dosage. Malaria vaccine announced. The vaccine was developed through a partnership between GlaxoSmithKline and the Path Malaria Vaccine Initiative, MVI, with support from the Bill and Melinda Gates Foundation from a network of African research centers. And another announcement, 500 million people to be vaccinated against measles. This is in Southeast Asia. Eliminating measles would avert 500,000 deaths, while controlling rubella and congenital rubella syndrome would promote the health of pregnant women and the infants they give life to. Immunization program managers of the Big Six countries, along with WHO, UN Children's Fund, UNICEF, Vaccine Alliance, GAVI, Bill and Melinda Gates Foundation, and the Center for Disease Control, the CDC, are deliberating challenges, experiences, and lessons learned in immunization in their region that can be harnessed to eliminate measles and control rubella and CRS. Now, that's just a few of the things that's going on. There's many, many more. Just go on the UN website, un.org, click on the English version, and on the top right there's a little search bar. Just type in things like Gates, GAVI, vaccines. You'll get an absurd amount of hits. It works much like Google. Now, GAVI, the Global Vaccine Alliance. Who funds GAVI? Well, its main partners are the Bill and Melinda Gates Foundation, UNICEF, the World Health Organization, and the World Bank. In a previous video I talked about GAVI influencing the Canadian Parliament by lobbying our politicians. Well, it's not just GAVI doing it. It's really a proxy for the Gates Foundation. Gates is a huge donor with so far over $4 billion put into it. The links are available. Now, who actually funds GAVI? As a founding partner of GAVI, the Gates Foundation has brought international attention to the cause of immunization and has made several commitments to GAVI totaling $4.1 billion to date. In 2000, the foundation made an initial $750 million commitment to the vaccine fund. In February 2007, the foundation committed $50 million to launch the first AMC to expedite the development and availability of pneumococcal vaccines. In 2011, the Gates Foundation committed over $1 billion to GAVI over the period of 2011 to 2015. It goes on. At the Berlin Pledging Conference in 2015, the Bill and Melinda Gates Foundation announced $1.55 billion for GAVI's next 2016 to 2020 strategic period. Mastercard's contributions to GAVI. Now, don't laugh. This is actually referring to Mastercard, the company, much like, basically Visa's counterpart. They're leading the way to a world beyond cash. Mastercard has made bold commitments to financial inclusion to reach 500 million people previously excluded from financial services by 2020, including 40 million merchants. What Mastercard is doing and why they're invested in this is they see, particularly with mass migration and increasing influence in like Africa and the Middle East, they see an opportunity for new customers. This is about reaching a new market for them. Nothing humanitarian, nothing goodwill. It's just, we can get more people involved. And there was a video that Short Fat Otaku did. I'll have to put that in the video as well, where he makes the semi-serious title, Mastercard is the final boss. It's a great video, about 40 minutes, but well worth it. Elma Vaccines contributes to GAVI. In 2014, Elma Vaccines and Immunization Foundation pledged $2 million to support urgent supply chains needs at country level to overcome barriers to delivering temperature-sensitive vaccines to remote areas. In 2018, Elma partnered with GAVI's Infuse Pacesetter NextLeaf Analytics to scale up its innovative temperature sensing technology to support the cold chain, aiming to increase coverage and vaccine programs in Tanzania. Elma pledged $1.7 million and was matched by the Bill and Melinda Gates Foundation. So 1.7 plus 1.7 works out to 3.4 million. There are tons of donors to GAVI, and this is just a few of them. It's not just organizations, but countries as well. Gates put in $4.1 billion, Canada $435 million, the European Commission $241 million, La Caixa, the banking, $15.7 million, Audacious Alliance $9 million, Red Nose the Fund $6.1 million, LDS Charities $4.2, Girl Effect $4 million, Mastercard $3.8, Orange Healthcare $2.7 million, International Fed Farm Wholesale $1.9, Elma Vaccines $1.7, Al-Ansari Exchange $1.7. And I put the link in. It's a long list. The World Health Organization and Immunization Agenda 2030. A global strategy to leave no one behind. And by leave no one behind, leave no one unvaccinated. Immunization is a global health and development success story, saving millions of lives every year. We now have vaccines to prevent more than 20 life-threatening diseases, helping people of all ages live longer, healthier lives. With the support of countries and partners, WHO is leading the co-creation of a new global vision and strategy to address these challenges over the next decade, to be endorsed by the World Health Assembly. IA 2030 envisions a world where everyone, everywhere, at every age, fully benefits from vaccine to improve health and well-being. IA 2030 strategic priorities will be further refined in the monitoring and evaluation framework and will include indicators, targets, and methods for tracking progress. IA 2030 goals are designed to inspire action for implementations. For regions, this could mean contextualizing global goals and setting specific targets and milestones in regional vaccination agenda plans. So it's, I guess, basically an offshoot of Agenda 2030. Well, heck, they even have the same name. ID2020 and vaccines. no, this isn't really another conspiracy theory. We need to get digital ID right. Closing the identity gap is an enormous challenge. It will take the work of many committed people and organizations coming together across different geographies, sectors, and technologies. But it is exciting to imagine a world where safe and secure digital identities are possible, providing everyone with an essential building block to every right and opportunity they deserve. Now, who funds ID2020? Microsoft, GAVI, and Accenture are three huge ones. Microsoft, isn't that Gates' company until very recently? Isn't GAVI funded by Gates? And they're also financed by the Rockefeller Foundation. Good to know. Gates Foundation is a huge donor for the World Health Organization. Just go on their website and they will provide the details. The Bill and Melinda Gates Foundation, Gates, is a funding organization based in Seattle, Washington, USA. Funded by the belief that every life has equal value, this innovative group works to help all people lead healthy and productive lives. In particular, this foundation focuses on improving people's health and giving them a chance to lift themselves out of hunger and extreme poverty. The valuable resources shared help empower people for activities. And among their priority areas, develop effective and affordable vaccines, medicines, and other tools. The Foundation's global health program that accounts for about 50% of total spending focuses on 20 diseases. Top 5 are diarrheal diseases, pneumonia, malaria, AIDS, and TB. Right investments in healthcare training and qualified medical workers and research for science is how we accomplish it. And Gates is connected to everything. Gates openly supports population reduction, like you can find YouTube videos of him talking about it. Gates openly supports vaccines for everyone, except his own family, of course. You don't want to get your kids involved. The Gates Foundation attends UN population conferences. The Gates Foundation finances vaccine research. The foundation is one of the main founders of GAVI, the Global Vaccine Alliance. The World Health Organization is largely funded by Gates. GAVI and Microsoft, really Gates proxies, are both founding partners of ID2020. So, did Gates cause this coronavirus pandemic, hoping to cash in on it? Or is he simply a shameless opportunity who's making the most of the situation? And one other thing I wanted to share. A lot of people have heard about this already, but Pirbright Institute. In 2015, Pirbright patented some coronavirus strains, and Pirbright is funded by Gates. I'll leave the video article in the description as well. So, some information about the patent. The patent number was filed in July 23rd, 2015. The patent was granted in 2018. And the signee is the Pirbright Institute. And it's Coronaviridae, neonatal calf diarrhea virus, feline infectious peritonitis, canine coronavirus, and some just descriptions are provided of what it actually is, and various types of coronaviruses. So this was work done by the Pirbright Institute, who Gates is a huge funder of. In fact, if you go on Pirbright's website, it will tell you about the funding that it gets from the Bill and Melinda Gates Foundation. And so, like I said, there are plenty of videos on YouTube and elsewhere. Gates talks about how there are too many people, the world needs less people. But yet he also claims that his vaccines save lives. So a man who thinks we need population reduction is putting money into developing vaccines that he won't give to his own children. Am I the only one who sees the bullshit on this? No, probably not. But I think back to the 1990s when Gates was only known for being a ruthless software billionaire, where he was known for forcing his competitors out of the computer business. He wasn't known as a eugenicist or a vaccine fetishist. He was just known for software that, well, was filled with bugs. Anyway, that's all I have for you in this video. All the links will be in the description. If you enjoyed it, please like, subscribe, and share, and post a comment. Thank you, and have a good day.